I'm the nurse practitioner and founder of The Natural Nipple, and I have with us today Dr. Ochoa, Kelly Ochoa, who is a double board certified pediatric medicine doctor. And so the title of today's Ask a Specialist is Health-e Pediatrics, how you are helping to bring peace of mind to people's homes. So can you tell me a little bit about your transition, Kelly, from being a mom to starting this amazing company and exactly what you do?
Yeah, absolutely. Thanks for having me. So I can tell you a little about my journey and then how Health-e Pediatrics kind of emerged and where we're at now. So I went to med school in Wisconsin, and then I did 3 years of pediatric training out in New York City. So after that, you can be a general pediatrician, and then I decided to do a fellowship, so extra training in pediatric emergencies. And so we did a 3-year fellowship out at CHLA, so Children's Hospital of Los Angeles. And then I moved to Central California, where I've been working in the ER. And so the ERs are always crazy busy at night. And so from like 8 to midnight, kids always seem to get sick at 10 p.m. on a Friday night when clinics are closed. And so we always have to upstaff on the weekends and the evenings. And so I just had this idea that maybe I could fill that niche through telemedicine. So that's how Health-e Pediatrics emerged. And so we're open evenings and weekends, 5 to midnight, to provide telemedicine visits to parents worried about their ill children when clinics are closed, and hopefully avoid an ER visit. So that's kind of in a nutshell how it's emerged. We just started, we just opened up, and it's been kind of a whirlwind trying to get it started with the 4 kids at home during a pandemic and schooling, and my husband works full time. So it's been fun though. I've really, really enjoyed being able to see parents in the evenings just through a simple telemedicine. I send them a link, we're on video, and you know, it works out really well, and I'm excited to see how it grows.
I'm really excited for you, and this is such a brilliant niche and gap in industry I think that you've addressed, because you know, having done like rotations in the ER, I know a big problem is people are sort of coming in for less than complex cases, and so that ultimately ends up making your wait time be sometimes like 6 to 8 hours. And so with a simple telemedicine visit, you're really providing the triaging for parents to save them like not only that much time, but an enormous bill if they may not have to actually go in and get hands-on care. So can you give us a little bit of insight? Maybe there's one patient that you've had recently with Health-e Pediatrics that resonates with you, or you know, don't use names, but
sure. Just in general, I've seen a lot of you know, like fever in the little ones. Parents are always really worried. Their 4-month-old has a fever. What do I do? How much medicine do I give? What do I watch out for? Should I bring them in right now? And of course, we see that all the time in the ER. You're right. It's not necessarily an emergency in our view, but to a parent it is, and so they can't wait till the next morning. So it's just been really fun to be able to educate parents and let them know what to worry about. So fever, and then sore throats. I've seen rashes, diarrhea and vomiting. And one of the things that I love most about my job in the ER is being able to educate parents on their child's illness. And I just love it when I have a parent who's really inquisitive and really wants to learn, and I get the chance to educate them on what's going on with their child. And I think that's a lot of what I do, is provide guidance on when you need to go to the ER and what you need to watch out for and what medications can be given. And if a prescription is needed, I can do that as well. So it's just been fun to be able to help these families avoid an ER visit. But one patient, you asked one patient in particular. Yeah, that's hard to say. I feel like I just really love when parents ask questions and I get to teach them. Yeah, it's just fun.
And I think it's so needed, especially maybe like first-time parents who are seeing these symptoms for the very first time, and you have, you know, a screaming baby with you, and you're panicked because this is like the person in the world that you love the most. And so you're truly providing such peace of mind by being able to do your assessment and your triage at home, and then, you know, go from there if you need to escalate and move to in-person care. So Can you walk me through a little bit of what starting this company looked like for you? Because you're still full-time clinician. Like you said, you have four girls at home. So how did you?
Yeah, it is a little crazy.
One?
Oh, good question. Yeah, you're right. I mean, I am totally trained in medicine and not in business and not in running a practice and not in any of the logistics of anything. So this idea actually emerged back last summer and we just opened. So it's been quite a bit of background legwork and insurance. I accept insurance. So a lot of online providers just because it's easier just to take cash only. But I really wanted to be available without having only cash only patients. I wanted to have patients be able to build their insurance. So that's what took probably 8 to 9 months, and I'm still working on that. So that's been my biggest hurdle. And then having the kids at home, right? So I homeschooled this last year, 4 kids. And so it's like, yeah, sleep, what is that? So, but you get through it, right? I mean, like every stage in life, there's challenges and like excitement. And I know, I feel like this is such a niche, and like the feedback that I've gotten from the patients that I've been able to help has been just, I think, inspiring, and it helps me move forward and keep pushing and make this clinic a success, or this business a success. And hopefully I can help a lot more. And I think that's what pushes me to keep going.
Absolutely. And I mean, from like the B2B and the hospital standpoint as well, I'm sure insurance companies are so grateful that you exist and that you persisted, Kelly, to be able to, really, I feel like you're doing an important job of protecting the front lines as well, to make sure that our like fast tracks and the ERs are open for like truly like hands-on complex cases, like when you need it. And that being said, like the after hours thing is so crucial, because like the occurrence, I don't know what it is at sundown, like you said, but this is when really all the kids are coming in and getting sick. So yeah, I'm curious a little bit about your background. You said that you have 4 little girls, and what are their ages?
Yeah, so when the 4th one was born, the oldest was 4. So they're all really close in age. Yeah, and now the youngest is 4. So the oldest is now just turned 9. So between 4 and 9. So what is it? 4, I have to think, right? 4, 6, 7, and 9. And so, yeah, they're at the ages now that, like with teaching for homeschooling, I make the 9 and 7-year-old help the younger ones with their letters and their reading. And so I can kind of delegate a little bit, which is helpful. And they can help around the house. So, each stage has its own challenges, but right now I feel like the older ones are a little bit more independent and helpful, and can help, even get lunches ready while I'm in a meeting or so. It's a juggling act, as every parent knows who works, and even parents who don't work, there's like juggling with everything. So
Yeah,
we make it work.
absolutely. And I feel like that also really helps you be able to build rapport with your patients, because like you are living some of their experiences. Like you're living some of these scares relatively recently that you might have had with your own girls. And so being able to translate your like maternal skill into your medicine, I think is truly like key for providing some empathetic care. And so I'm sure I've seen your reviews on your site that your customers have left you, and I know parents feel that they can really confide in you, which is huge, because if you're not taking the time to listen to your patient really exactly where they're at and empathize, how can we truly provide a holistic assessment and get to the root of the problem? So it seems like that is the rapport that you've built with your virtual medicine practice.
Yeah, I actually really love that aspect, because when I work in the ER, I feel very rushed. Everything is rush, 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 time, time, time. I have 2 minutes with this patient and I know there's 10 waiting. And I feel like this, I can kind of set my own schedule. So I've set like half an hour appointments. I've taken my time. I have, I kind of dictate my own schedule. And so I'm allowed to spend as much time as I want with my patients. And I love that part, so yeah, you're right. I love connecting with them. And I'm glad you bring that up, because that was actually when I first started this business. I think about how many times I've used my past training and experience and what I've seen to know that, okay, my kid is okay. But even like the mom in me is worried. So I can't imagine if I don't have that training and experience in the ER or medical training. I can see, I mean, you're really worried about your kid at night. I remember our firstborn had one of those crying fits, you know, where you just know they're in pain and you don't know what's wrong. And we see this all the time in the ER, little babies coming in with their parents. The chief complaint is that they're crying, right? They don't know why, they're just crying and crying and crying. And so, you know, I was able to do like my little head to toe that I would do in the ER. And, you know, she was just screaming, but I knew it wasn't something serious. And to be able to share that with other parents who are going through that, I can easily do that over a video. So, yeah, I'm just really excited that this is working out and finally opened up our virtual doors. And yeah.
And I love going back to what you said, that you really worked hard for that 1 year of building your platform to be able to accept insurance. Because so part of what we provide for the natural nipple is a telehealth visit with every bottle purchase. And so that's baked in, like that 30-minute triage and consultation. So it doesn't have to necessarily be an emergency, but we do a really holistic health intake. And usually our clients are struggling with more lactation issues and latching frustration. So for instance, we had, I think it was last June, it was in the middle of the pandemic, and we had a patient that she had a 14-week-old and hadn't fed, like wasn't able to latch to breast to feed for 24 hours. So they were really concerned. They were like, okay, do we need to go to the ER, get an IV, or do we need to totally switch over to bottle feeding right now and formula, because we didn't have enough pump milk. So just by sitting there, and like you said, you have that opportunity for undistracted quality time. You don't have someone banging on your door to come like into the next room. Really, we're successful to be able to help her get that latch, and also, you know, prevent that burden to the front line as well with going into
totally.
the ER.
And
so,
prevent an IV in a baby. I mean,
and that
I love what you're doing, because as a pediatrician, I am a huge advocate of breast milk, and as a mom that nursed all 4 of my kids through work, through pregnancies. I was pregnant and nursing for 7 solid years. It's just, yeah, that day that my last one was, I'm done nursing, was like a celebration. But I can also, like, the struggles is real for breastfeeding, and but the benefits are so much greater. So I think it's awesome that you're able to do that. Yeah, and prevent that patient from coming to the ER and seeing us and getting an IV probably.
Absolutely. Or also just referring, like if we catch in the intake form, you know, this is a little more complex. You know, we have Dr. Ochoa, who is an ER physician specializing in pediatrics. You know, we can help like go a little bit more in depth with their assessment there. But kind of to your point, what's really rewarding is you're also doing a lot of hands-on education. So not only like the techniques for latching are we able to translate, just like we are in a video right now, but even checking for skin turgor. We're like, okay, skin, see how to hide it. And so that's
video, it's easy.
Exactly. That's something a parent can remember to do next time. And I think it gives them that confidence, because what we saw, we were surveying the population before we launched the natural nipple to really identify what are the barriers to breastfeeding across the board. And so 92% of parents explain, you know, latching frustration that occurred after introducing standard bottles. The shape, feel, and flow, just sometimes the baby gets used to one, either breast or bottle, and doesn't want to swap between both. And sometimes you need to feed pump milk. There's times you can't always feed with your
baby. Working parents. Yeah.
So if we can mitigate that frustration and that time to get latched and that pain with latching, like by all means, let's do that. So that's what the natural nipple does. But then we also saw, you know, pain points just with lack of psychosocial support from the community and from clinicians. So I'm like, okay, we'll be the first bottle that comes with a telehealth visit baked in. And
awesome.
And then in terms of, you know, the digital solution as well, this is something we can actually begin to provide you some biofeedback. So I love this part because my research was in the microbiome of preterm infants. And so by being able to do a stool analysis at home and show you, at 6 months of age, this is your baby's unique gut bacteria profile. And if you're beginning to introduce solid foods, these are the kinds that will help boost the beneficial bacteria, or maybe where they have lower ratios. And so I'm just really excited for what you're doing, because 77% of the audience that we surveyed of new parents really felt that they just wanted confidence to know if they were feeding enough. And what you're doing is just providing access to care remotely and giving that confidence that's not only with feeding related issues, but with fever, like you said, with rash, and building their confidence in their assessment themselves.
So true. So true. Back to your point, like a lot of parents think they're not feeding enough all the time. I feel like they introduce formula when they don't need to because they think they're not feeding their baby enough.
Yeah.
Yeah, that's awesome. Yeah, for sure.
And sometimes too, it's just like, if you don't have that right latch or that deep latch, there's this perceived milk supply deficiency. They're like, I'm not making enough. Something is maybe wrong with my body. And so just like really being able to get to the root of that problem. And by doing a very complete intake, we can also assess, well, actually, it looks like you might have uncontrolled diabetes based on your history. This can affect, your lactogenesis. So really taking, a macro holistic approach and trying out different techniques to get to the root of the problem versus, just necessarily being like, okay, formula it is. Like,
right.
Let's really work with you where you're at.
I feel like, unfortunately, that's like the easy way to go when some people are advised that. And even in the ER, I'm like, no, breastfeed as much as you can. Don't just switch to formula. Your little jaundice is not, the end of the world. It's not that severe yet. I always advocate for breastfeeding. So they could consult with you on a telehealth.
And so
help.
Oh, go ahead. Sorry, Kelly.
No, I was just going to say to help guide them right on if they're producing enough and latching, and
absolutely,
it's great.
And what you're doing as well, it's not only helping new parents and children, but also you're providing primary care colleagues seamless pediatric care, because you are focusing on those after-hour clients. So can you tell me a little bit about how forming those relationships with key stakeholders has gone for you?
Yeah, sure. So that was my initial thought, is talk to all the pediatricians in town and help them provide, their after-hour care. And otherwise, parents would bring them maybe to an urgent care where they don't get pediatric-specific advice and knowledge and treatment. So I think it's really important when a child gets sick after hours that they see someone trained in pediatrics, especially if it's over a telehealth visit, and specifically someone who knows or experienced more sick visits. So I've been talking to just the general pediatricians around town here. I haven't reached out to many general pediatricians around California outside of Central California. So it's been fun to get to know some of the general pediatricians, because in the ER, we don't necessarily talk to them. I see their name on the patient record and they see my name on my discharge summary that goes to them, but it's really just a nonverbal written communication. So it's been fun to be able to talk to some of the general pediatricians in town and actually get to know and have a face corresponding to the name that I know. So it's been fun that way too.
And I'm sure they're very, very grateful to be able to provide, their clientele, like we said, peace of mind and home, like when they're as well. So I know you're focusing right now on California, and we covered, for everybody that's just jumping on and listening, you do accept health insurance, which is huge. Not many telehealth providers.
No, they don't.
Yeah, exactly. So what can any listeners who are just tuning in now do to essentially get a visit booked?
Yeah, so it's easy. You just go to my website, click on book now, and right now I have you call us and we register your child, and then send you an email link where you just sign up for the portal and join the visit. And so soon to come, the logistics are still kind of being worked out, will be self-scheduling. So basically you just go to the website, click book now, pick your appointment, register your child, and click join the visit. And so, yeah, I'm trying to work out how that can be more seamless. And so right now we have it through a phone call, which has been working out really well and fine. I just have someone do the intake and the registration, and then they click on a link and join. And then I always like to write personalized discharge instructions for their specific child. So I write those and I send it to their portal. And so after the visit, if they're always tired and they might not hear or remember everything that I had advised. So I write it all down and put it in a discharge summary that's available on the portal. And then they can always refer to that. What was it that I have to look for? What temperature, how much medicine, and then I had put a fever medicine calculator on our website that I refer many patients to. If they have a fever, they can go to the footer of our website, and it'll calculate how much Tylenol and ibuprofen they can give their child, because I always see parents underdosing. When they come into the ER, they'll just give like half the dose or less than half the dose, and it's not going to work. I'm not a big advocate of medicine in general. I don't like prescribing medicine. I don't like giving medicine unless it's absolutely necessary. But if you're going to give Tylenol or ibuprofen, it's best to give the max dose so it works.
And that's a really important resource that's always available on your site. So it's Health-e like the letter E, pediatrics.com for everyone listening. And in terms of insurance and billing, do you specify on your site exactly the providers that you take?
Yeah. Yep. So we have a page on our website for billing, and it has the commercial insurances that we're currently contracted with. However, I've been telling my patients, if we're not currently in network, we're probably working on it with the insurance companies. And so what I've been doing, like from Blue Shield, everyone has Blue Shield and they are taking forever. Like literally I started the process in August. I'm still not contracted with them. So what I've just been doing is say, I don't want you to be billed out of network. So I'm just waiting on billing those. And as soon as I'm in network, it'll be billed as an in-network visit. So then the insurance company dictates what the copay is. I have no say in any of that. So whatever the plan is under the insurance company, they dictate, and I won't know that until the claim goes through. So it might be like 3 months later that we find out, oh, you have a $10 copay. So yeah, so that's what we've been doing so far. And Cigna is one that is not on there and we're not in network with, but I can bill as an out-of-network provider. So they typically, almost all commercial insurances I can bill as an out-of-network if I'm not in network, and they'll pay at least some, if not all, of the cash pay price.
Awesome. And so it sounds like you're really flexible with like where the parent's at, and
I'm really trying to be as inclusive as possible, make it easy. I have insurance. I pay a lot for our insurance. And so I wouldn't want to pay extra for an evening visit if my insurance would, if I could use my insurance. So ultimately that's why I ended up taking insurance. I want to, help as many parents as possible have access to it through their insurance.
That's really a beautiful mission. And, I'm looking a little bit at your bio, and you've evaluated over 30,000 children. So with conditions, like you mentioned, ranging from minor rashes to, life-threatening injuries. And so just as like a little nugget, I know you mentioned the fever calculator, the dosage that's necessary for Tylenol, which is a huge help. But is there anything else that you feel just from pattern recognition that you could share with parents, that just little nugget of wisdom to help them related to
what? I love this question because that is one of my passions. And one of the things on our website is healthy tips. And so I get asked the same questions all the time. I have my spiels that I give to parents for all sorts of illnesses, injuries, injury prevention. And so I'm hoping to share that knowledge with whoever wants to read it. And so I've just been randomly writing articles on things that I think of that are pertinent or that I've been asked so many times. So on our website, I have articles, and then on our social media site, we share educational little content as well. So every day or every other day we post just like a little, like we just did sunscreen, what you look for in a sunscreen. You want it mineral based, you want it over 30, you want it zinc oxide, you want to reapply every 2 hours if you're in water, things like that. We just did one on insect bites because, oh, the mosquitoes are getting bad. And so little things that we feel like have helped us as parents, and also that I've seen in the ER all the time and I feel like I can give advice on. We just post, so nutrition things, all sorts of different random things that I feel like would be helpful for any parent to know about kids' health. So we've been posting on our Instagram and Facebook, kind of just educational content. And then the longer articles, if someone's more interested in something, I've been writing on our website. And so I've just been accumulating those as I write them and post them, and hopefully help someone out.
Awesome. And so where can our listeners find you on social?
Yeah, so our handle is Health-e Pediatrics. So E as in electronic, so health, and then E as in electronic pediatrics. So if you search that, that's on Instagram and Facebook.
It's so helpful, Kelly, what you're doing. And I'm just really impressed with you, founder to founder, with what you're balancing with your full-time role as a clinician in the ER, homeschooling your children right now, and launching this company. You can tell that you truly have a passion, for helping provide parents peace of mind and children with holistic, empathetic care. So I just want to thank you so much for your time. It's Saturday on 4th of July weekend, and you're spending time.
That's what I have after hours, right?
Yeah. So I think you've provided so much value for all of our listeners. And is there anything else before we jump off that, maybe we didn't cover today that you want to pepper into today's episode?
Yeah, no, I'm just excited to be here. I'm excited to help parents, and anyone who wants to learn a little bit about parenting tips, hop onto our Instagram and Facebook. And thanks for having me. It was so good to chat with you, Lauren.
Yeah, thank you so much.